and I don't have it in front of me.
We're seeing more breakthrough cases. It has people nervous. It has people not wanting to get vaccines. We're seeing reports all over the country. What do you want to tell these people who are concerned about the breakthrough cases right now? From your perspective, are these breakthrough cases concerning? Do we need to change our habits? Do we need to change everything we're doing? Are there a vaccine that, from your perspective, from when you're sitting, isn't working? Is that why these are happening? What are you seeing, I guess, from your perspective?
Absolutely not. We're still seeing that these vaccines are incredibly effective. And we, as with any vaccine, we'll see some people who will contract the virus for which the vaccine is made. The number of people who may contract that virus is very small. And what we know, especially with these vaccines, very importantly, is that it really reduces severe cases and hospitalization. So if you are infected and you still do contract COVID-19, the chances that you will end up with a severe case or in the hospital are extremely small. And that is what the vaccines are built to do. So no, I certainly hope people are not encouraged not to get the vaccine because of this. I think if anything, we should be encouraging it more because we know that it will prohibit that severe illness in people. And the more people who do have the vaccine, the less chance the virus has to transmit from one person to another, which is when we get to the point of herd immunity, right, where we can essentially eradicate any sort of communicable disease. That's really the goal.
I think whether or not you have data in front of you right now, it's very evident that our deaths have declined drastically since the beginning of this pandemic for a multitude of reasons, be it the treatment that we can provide and the vaccines combined. But when you're looking at death numbers still too, and you don't have to speak specifically, I'm just telling you, when I had them yesterday for that 2-week period in August, a fourth of the deaths were people who were fully vaccinated. My question though is, we don't talk about comorbidity in Michigan. It's not been something that we have tracked through the pandemic. But I think a lot of people are wondering, out of those 107 deaths that happened in that 2-week time span, are we looking at cancer patients? Are we looking at healthy people who weren't dealing with an ailment prior to getting COVID? Because a lot of people are concerned when they see these numbers, but at the same time, people are wondering, is there some other attributing factor? What can you say to the people who are thinking this now and kind of wondering when they look at the numbers?
I really couldn't comment again, because as you said, we don't track those comorbidities. But one thing that we do know, and that the FDA and ACIP has just reaffirmed, is that people who may be more immunocompromised should be getting a third vaccine to try to help increase that immunoresponse. So we are encouraging and we are getting out to individuals to get that third vaccine to help maintain a reliable level of pathogens to maintain a healthy immunoresponse to the virus.
Now, and we are seeing more breakthrough cases. We are just seeing them not just but nationwide. Do you have concerns about no mask mandate being in place in Michigan? Because it's something Dr. J has said she wanted, but it's something that Governor Witt maintains will not happen. You know, the call really comes probably from you in the MDHHS. So where are you with that? Do you see anything changing in the near future from your office?
We've been very clear at the Department of Health and Human Services. One of the things that we have learned, one of the best ways to mitigate the transmission of COVID-19 is by wearing a mask. There are, of course, other mitigation strategies that we layer with that, include social distancing, appropriate hand washing and hand hygiene, and then, of course, being vaccinated. We've been very clear in our school guidance that one of our recommendations is that school districts mandate mask wearing. So I don't think at this point there's a need to have a mask mandate. We've been very clear on what the state health department's recommendation is that we think schools should do to keep kids safe.
But right now, not every district is doing that. There are some that are, there's some that aren't. So you concerned that they're not going to follow those recommendations? And if they don't, can we expect to see a mandate?
It is very unfortunate that all of the school districts who have traditionally and historically been really good about following the advice of both the state health department and the local health departments are feeling the pressure, I think, politically on whether or not kids should be wearing a mask. But there's no question, and again, we've been clear and the local health departments have been very clear, mask wearing in schools for all kids, regardless of vaccination status, will make the school year significantly less risky for those kids and ensure that they can stay in the classroom.
So if the fear become a reality, the fears that you're mentioning or the fears that Dr. J has mentioned, we see a mandate come down in next month or two if we see a spike in cases among children.
You know, I really wish I could tell the future when it comes to COVID-19, but unfortunately, we've learned a lot over the last 18 months. And one of the things that we have learned is that we'll learn more every day. So right now, we are continuing to track our case rates, those Delta variants, focusing on the ability to make vaccines available for people so that we can continue to increase our vaccination rates, and being clear on what we think the most effective way to keep kids safe and healthy is for school districts.